Hi, I'm Ashley James with Good Morning Maryland. Thank you so much for joining us here for our September Facebook Live. This is a chance for you to have an interactive discussion with a doctor that we have here. We hope you will stay tuned into this Facebook Live and ask any questions that you might have. So let's talk about the topic. It's really one that we don't hear a lot about. What happens to domestic abuse survivors that are trying to start over? How can they heal both physically and mentally? GBMC Healthcare has an amazing program to help these survivors. We're talking women, men, and children. So here to tell us more about the face-to-face program is Dr. Sam Hahn. Dr. Hahn, good morning.
Hi, good morning. Thanks for having me.
Thank you so much for joining us. This is a really interesting Facebook Live that we're doing. It's really specific and it's really important. So I want to talk to you about this face-to-face program that GBMC Healthcare has. Tell us a little bit about it.
Sure. So the face-to-face program is actually a national program that's sponsored by the American Academy of Facial Plastics and Reconstructive Surgery and the National Coalition Against Domestic Violence. And this program is geared to help survivors of domestic violence who are experiencing not only physical distress, but also emotional trauma from some deformities that may have occurred as a result of domestic violence. And this program is done on a pro bono basis, so it's all volunteer surgeons who donate their time and resources to help these survivors to sort of give them back their sense of self and to give them a fresh start.
We want to say hello to some people who are jumping on our Facebook Live right now. Dawn, hello. Glenn, Callie, Patricia, Tim, thank you so much for joining us. Hello, hello. It sounds like a great program. When we talk about some of these injuries that you see from domestic abuse survivors, what are the most common injuries?
Sure. So obviously it could be a wide-ranging variety of injuries. And to be clear, this program is geared for not the acute setting. So this isn't someone who just has suffered an injury, recently, but it's actually for those who've had some lasting scars, mostly. So facial scars, or maybe a crooked nose from a broken nose a long time ago that it's still lingering and is causing emotional distress for the survivor. So in the acute setting, obviously they would seek care at a local emergency room, and the goals of this program are sort of to guide them through the entire recovery process once maybe the acute illness or injury has been treated.
So when people come in and let's say they've had these scars for years and they're just ready to get them taken care of, is there still emotional scars that stay with them? I mean, kind of talk us through,
Sure.
how they come in and what their mindset is like.
Sure. It's obviously, I can't speak for the survivors, but visible scars are only a very small portion of probably the great burden that they're carrying with them. So my goal is, what I'm trying to achieve through this program is to at least take some of the stigma that might be associated with a scar. So if someone has a visible scar on their face, oftentimes it might be one of the first things somebody else who meets the person sees, and it could be you could take the focus away maybe from the person themselves. And so I want to empower the survivors. So by minimizing the scar or camouflaging the scar, you can sort of take focus away from that scar. They can feel like themselves again, not have to either explain or try to hide a scar.
We had a question coming in on Facebook. How long does it take to operate on a woman or man or child who has been abused? I know this is a broad question. But
sure, yes. Obviously, it's a case-by-case basis, so it can depend. So the treatments that we offer can range from small procedures that we can do in the office. So it can be done under local anesthesia, and we can provide treatments within that outpatient setting, in a clinic setting. Or if it's more extensive, it might require surgery within a hospital setting. So I've partnered with GBMC to provide this wonderful service.
Another great question that just came in, is there an application process and what is that like?
Sure. Yes, there is a formal application process. So this service is provided through the National Coalition Against Domestic Violence. So any survivor who may qualify for this program, I encourage them to speak to a counselor at their local shelter, and they can guide them through the process. The application is then submitted to the national center, and it gets then forwarded to the respective plastic surgeons.
Okay. Another question we had, where are these treatments done?
So the treatments, again, are the initial consultation for someone who may qualify is done in the surgeon's office. So there are a number of surgeons who participate in this program. So I'm just one of many surgeons nationally who participate in this program. And if there is a qualifying patient, then we will meet with that patient in our office. We'll come up with a treatment plan. And then depending on what that treatment plan entails, if it's something we can do in the office, we'll do it in the office. If it is a little bit more extensive or for patient comfort, it requires anesthesia, then we'll contact the hospital and we'll arrange for that to be performed in the hospital setting. Okay,
we had another question that's coming in on Facebook. What is the average cost of facial reconstruction surgery is what it says. So with this surgery, I know that it is free through this program, but how much money are they saving? I mean, typically for these types of treatments?
Again, yeah, it varies because it can range from in-office procedures. A small procedure can run several $100s to if they need general anesthesia in a hospital setting. That could be quite an extensive financial burden on them because it's not only the surgical fee, but also the hospital fees that's associated with this. So through this program, by offering it completely free of service, we're alleviating a huge financial burden for the survivor, so they don't have to worry at all about that they might be given a bill later on.
How long have you been involved with this program, did you say?
So this is our second year through the program.
Second year, and how has it been so far?
So part of the reason I'm coming here to talk about it today is that it's been around actually since 1994, but I don't think the general public is actually aware of this program very much. So I want to bring more attention to it, bring more awareness that this program does exist, and that this is a service that is provided at no cost to the victim. So.
Yeah,
I want people to know about
really
it.
We just need more awareness about this program. And I think it's great that you're coming in because like I was saying, I had never heard of something like this, but it really is great. And we would probably be shocked to know how many people need this.
Yeah.
Don't you think? Okay, so we mentioned earlier that it's not just for women, right? I think we all have this idea sometimes that domestic abuse survivors are just women, but it's men and it's children. Are children treated the same way as the women and men, as the adults in this program?
Sure. So if there is a child who suffered from domestic violence and they unfortunately have some lasting deformities from that, it would be the same process. They would still go through the same application process, and we would meet with the child and whoever the guardian is and come up with a treatment plan, and we do the necessary reconstructive surgeries or treatments as needed. Okay.
How young can kids be for this program?
There's no age limit for this. So obviously there are certain procedures that, for example, if they had like a nasal injury and they have let's say a crooked nose, they need to have nasal surgery to correct that. But in a growing child, you don't want to disrupt some of these vital growth plates. So you may opt to wait till they're older or fully grown, but if it's something that's causing significant distress for the child, on a case-by-case basis, we may be done, in someone who is younger.
Are all applications taken?
So anyone who feels they may qualify is free to apply. So there's no cost associated with applying. Once the application is submitted, there is a formal screening process that goes on, and so those who qualify will then be notified and arranged to have a consultation.
Okay, can you talk about, and I know you could just keep it general, but what would qualify or disqualify someone from the program?
So qualifications are, it's is fairly broad. So they have to have an injury that occurs to the head, face, or neck, because this is through the facial plastic surgery program. So other parts of the body do not qualify for this program, and it has to have occurred during a domestic violence incident. So it's a stranger assault or accident, a motor vehicle accident or fall, something like that would not qualify for this program.
You talked about the applications can be done at domestic abuse shelters.
Yes.
So that brings me to House of Ruth, and they have the Fill the House campaign, and so they are looking to collect diapers for women, or diapers, and then for women, children, undergarments, pillows, twin sheet sets, comforters, blankets, personal care products. You can all help with this. There's a great website to go to. Visit gbmc.org/House of Ruth for donation drop-off locations, because they're all around. And then there's an Amazon wish list. We were talking about this earlier, that is so easy. Yeah. That makes life so easy if you don't have time to stop and drop things off to the House of Ruth with this Fill the House campaign. We all use Amazon, so it makes it it makes it super easy.
Who
but
doesn't?
You know, a lot of these victims just need these basic items that we all take for granted.
Yes, absolutely. Please participate in this wonderful program.
Yeah, that would be great. And I know we have a graphic to put up there, but getting these basic needs met allows victims to focus on getting counseling, legal service, housing, job placement. It's all the things they need to begin a life away from their abuser. It's so important, and just a little bit goes a long way. Oh, and just to mention, all items need to be new and unopened. So please help us out with that. Again, House of Ruth, Fill the House campaign. We have a lot of needs going on there. Right, so back to Facebook and some questions coming in. We were talking about the face-to-face program here on Facebook Live, a great program. What are some of the, when you're finished with a patient, right, and you do the treatment, you do the procedure, what do you hear from patients? What is that like to hear from a patient afterwards? I mean, you've changed their life.
Sure. So, you know, it's a very humbling experience, and I think that's part of the reason why, you know, I got into plastic surgery to begin with, is to sort of be able to be a part of this transformation where someone feels empowered and feels whole again. And so, you know, it's really, it's hard to describe how gratifying it is when someone comes in and they're just so relieved that something that was on their mind for so long is no longer you know, something that they have to worry about or even think about on a day-to-day basis. Yeah. Just that release of emotional burden that they feel. It's, you know, it's a really gratifying experience. Good.
Are you affiliated with GBMC SAFE program and the domestic violence program? Talk a little bit about the SAFE program.
Sure. So I personally am. This program is not necessarily an affiliation with the GBMC program. I certainly work with the GBMC SAFE program. So this program is a national program, and so I'm just one of the many providers that participate, that volunteer for this program. Is that my office, you know, is within the premises of GBMC. So if I partnered with GBMC to provide this service. So I do work closely with the GBMC SAFE program, and if there's any survivors who may benefit from the face-to-face program, I certainly make sure that, you know, all the resources are there available for them.
Okay, great. Anything else that people who are watching this Facebook Live should know about the face-to-face program?
Well, I would say just spread the word, and if, you know, because I think this is a wonderful program that has not gotten enough attention. And, you know, there's many, throughout the country there's many surgeons, and even in the Baltimore area there's a number of surgeons who participate in this program. And, you know, we certainly are here to help, and we want to make sure that those who may benefit from this program know about it.
Right. So it's so important to spread awareness. If you know a domestic abuse survivor, or if you are one yourself, we want you to know about this program. You can get information online. It is here for you. So thank you so much for being with us and providing us this information that I don't think, you know, a lot of people know about it. It's so great. Thank you so much, and thank you so much for watching. Here's some additional resources and some numbers for you. These are all available 24/7. Thank you so much for watching our September Facebook Live. We will see you back here next month. Have a great day.